The story is told in what we're seeing in terms of people who are, the numbers of cases, the numbers of people in hospital. It tells me that people are doing what we've asked them to do. And no more time is it important to do that than this weekend. We can watch what's happening around us, and I think that's a really important thing. We are, as I've said, we seem to be holding our own, and I believe that's because people in British Columbia are doing what we asked them to do. We also have some data that's come from a couple of big data sources that show that we can measure that, and that people aren't going out and about, as I say, as much as they were prior to our recommendations. And we just need people to hold this line. You do need to hold this line because we need to keep our communities safe and our families safe here in BC. The outbreak and the pandemic is different across the country and across the province. We're a very large province with quite different demographics and different geographic issues. So yes, in many places where there's single introductions, for example, although I will say that right now we have community transmission in most areas of the province. So it's a bit challenging, and we also know that people have come back from traveling to many areas of the province. So we need to measure that as well. But we are looking at what can we do to try and relax some of the issues, or to increase some of the, for example, the healthcare needs, and address those in a safe way in different parts of the province. And we will be tailoring it as best we can to what's happening in the different areas that we know of. And part of that we'll talk about later next week when we look at some of the modeling. But that thinking is going on now for sure.